So in this video, I'm going to be focusing specifically on the mental health challenges faced by women in India today. And this is going to be based on the clinical practice and the lot of research that we have done at Wellness Space. So at Wellness Space, we have documented data of close to 1,500 people who have come to us, and out of that, almost 2/3 are women. So I'm sharing these insights based on last 3 years documented data of in-depth interviews of close to 1,000 women who have come to our center for help with mental health issues. Out of all these women, about 45% of these women come with severe anxiety, and about 56% of them have severe depression issues. 57% of the women who have come to us have actually had suicide behaviors, which means suicide ideation, active suicide thoughts, and out of them 7% have also a history of suicide attempt. Almost 60% of these women have relationship issues, and 65% have a history of eating disorders. Almost 1 out of every 3 women who come to us has severe childhood trauma. So their ACE score is more than 8. And we at Wellness Space also have a lot of research, and there is a lot of global research in the last 3 decades that says that childhood trauma is one of the very, very strong factors for adult anxiety, depression, eating disorders, suicide behaviors, obesity, and a host of other mental and physical health issues. The women who come to us commonly face challenges in their relationships. They have body image or weight issues, uncontrollable anger. A lot of them come with severe anxiety and depression, which also affects their ability to be a better parent to their child. In fact, a lot of women come to us because now they have a child and they are concerned about their own mental health because it is affecting the child as well. The modalities that we use at Wellness Space are aimed at working on the root cause of these mental health issues. So we do not directly work on fears or phobias. Almost 80% of the women who come to us have irrational fears and phobias. We do not work on anxiety, depression, fear, phobia, or obesity, but we work on the root cause, which we believe, and which is also backed by research, the root cause of these issues, which is mostly their adverse childhood experiences. Research says that when it comes to suicide behaviors, there is a very strong correlation between a high childhood trauma score and suicide. And out of this, physical abuse, emotional abuse and neglect, as well as bullying, are some of the big contributing factors to suicide behaviors and suicide ideation. So we use modalities that work on childhood trauma files. We know that childhood trauma experiences are stored in the body as implicit and explicit memories. So we use techniques like memory reconsolidation, inner child integration work, regression therapy, hypnotherapy, as well as coaching and counseling in order to help these women come out of their mental health challenges. We also have data of women who have gone through 4, 8, and 12 sessions and what is the progress that we have seen in these areas. We also do regular assessments of PTSD, CPTSD, and also do use our interventions to bring down the scores of PTSD to the manageable level. So in the next video, I will be talking more about the in-depth work that we do in the area of mental health challenges for women at Wellness Space Ahmedabad, and I will be also sharing some case studies.